This patient is an example of recurrent genital infection despite treatment. A woman presents with 4 episodes of recurrent genital symptoms treated empirically with no response. What is the most appropriate next step? Treat partner immediately, change antibiotics, long-term suppressive therapy, reassure the patient, take swabs for culture and sensitivity. The correct answer is take swabs for culture and sensitivity. Why? After multiple failed treatments, the diagnosis must be confirmed microscopically. So, after multiple failed treatments, the diagnosis must be confirmed microscopically to exclude resistance, reinfection, or misdiagnosis from the start, okay? For appropriate treatment, as you know, untreated pelvic inflammatory disease may lead to Tuboovarian abscess. That's why for recurrent genital symptoms that is not responding to medical treatment, take swabs for culture and sensitivity. As the diagnosis must be confirmed microscopically to exclude misdiagnosis, reinfection, or resistance. Why the other options are incorrect? Partner treatment requires confirmed sexually transmitted disease. So, partner treatment requires confirmed sexually transmitted disease. Empiric antibiotics worsen the resistance, okay? This patient does not respond to the empiric antibiotic you gave him, okay? So, empiric antibiotics again will worsen the resistance, okay? You need to change the antibiotics, but after confirming the microorganism causing this genital symptoms. Suppressive therapy without diagnosis is unsafe. Reassurance is inappropriate. So, the most appropriate next investigation here is take swabs for culture and sensitivity. Take vaginal swabs for culture and sensitivity. That's why we need to confirm the microorganism before complications. Before complications, Tuboovarian abscess is a complication of pelvic inflammatory disease, commonly caused by chlamydia trachomatis or Neisseria gonorrhea infection of the cervix or vagina. So, for chlamydia trachomatis and Neisseria gonorrhea infection of the cervix or vagina, if not treated or if left untreated, it may spread from the cervix or vagina to the endometrium of the uterus and fallopian tubes, ovaries, and adjacent structures. So, Tuboovarian abscess may develop. Tuboovarian abscess is a complication of pelvic inflammatory disease. This is the Tuboovarian abscess. This is a 36-year-old female with right pelvic pain. This is the ultrasound and CT scans. It's contrast. So, grayscale and color Doppler ultrasound images. This is the grayscale image, and this is the color Doppler image. color Doppler image to see the vascularity, okay, to see the vascularity of the lesion. So the grayscale and the color Doppler ultrasound images reveal a large, thick-walled right adnexal complex lesion with cystic spaces. A large adnexal complex lesion. It's not cystic, it's complex lesion with cystic spaces, depress, and vascularity. This is the expected region of the right ovary. Okay, there is a large, complex lesion with cystic spaces and depress. Can you see the depress here? This is the depress. Echogenic foci. Floating echogenic foci. So this lesion, a complex right adnexal lesion with cystic spaces containing depress, one of them containing depress. Okay, and this lesion here showing vascularity. Vascularity within the lesion. The left ovary was normal. Contrast enhanced CT scan showing a complex right adnexal lesion with indistinct margins, cystic areas, and pelvic fat stranding. This is the contrast enhanced CT scan showing a large adnexal lesion with indistinct margins. Indistinct margins. This lesion contains cystic areas. This lesion contains cystic areas. Cystic areas. And causes a stranding of the adjacent fat. Stranding of the adjacent fat. The white lines here. These are stranding of the adjacent fat. Adjacent pelvic fat. It's not clear fat. It contains echogenic stranding, okay, indicating inflammation. This area, this lesion is of inflammatory nature. So this lesion contains cystic areas with adjacent pelvic fat stranding. REM enhancing partially loculated pelvic fluid collection is present. This lesion shows REM enhancement. Okay, REM enhancement. REM enhancement. This is a collection, a fluid collection with REM enhancement. REM enhancing fluid collection. Okay, this is tubular structure with REM enhancing. There is a right adnexal tubular fluid-filled structure. Right adnexal tubular fluid-filled structure with REM enhancement. A collection, fluid collection with REM enhancement. These findings are consistent with Tuboovarian abscess. Tuboovarian abscess formation maybe pyosalpinx and peritonitis are complications. All of these are complications of pelvic inflammatory disease. That's why we need to confirm the organism for adequate treatment of the pelvic inflammatory disease to avoid its complications as tuboovarian abscess formation, pyosalpinx, which may lead to infertility, as this patient is young adult. So for any recurrent case of for any recurrent pelvic inflammatory disease, take swabs for culture and sensitivity for appropriate treatment.